Hello, my name is Kat Tice. I'm going to be presenting on NICU breast pump education. The purpose of this video is to educate NICU nurses on the importance of breast pumping and just overall education in helping moms put together a breast pump and why it's so important. So the objectives here in the background section, we're going to be talking about the importance of early education, the importance of nurse-led interventions, barriers and facilitators that you might encounter when helping a mom, or just identifying why a mom may or may not be breast pumping, and the lactation consultant's hours. And then for pump education, it's just going over the specifics of pump parts and how to put it together. And then plan implementation. So what are we going to do with this education and moving forward in this? Out with the first topic, the background of this. The importance of breast pumping. Why are we telling moms to breast pump? So first off, breast milk is very important for infants. It has a chance to decrease necrotizing enterocolitis, and it improves neurodevelopmental outcomes, and it has been shown to help gut biome. When an infant is admitted to the NICU, there may be some delay in establishing breastfeeding. The infant may be too sick to eat, there may be too much oxygen, or blood sugars are low, so they might not show that they want to eat right away. So it's important to establish early milk expression as soon as they can, and to keep expressing milk, because frequent milk removal encourages greater milk production. So the more you do it, the better. And the recommendation is to pump within 6 hours of delivery. Nurse-led interventions are important in breast pumping. For one, it increases parental involvement. So they did not have a lot of control in coming to the NICU. This is not most parents' plan. And by providing them education on breast pumping, you can give them back some sense of control. They can help pump milk for their baby, and they can feel like they're doing something for their baby even when they're away. And as nurses, we spend a lot of time at the bedside, so we have time to educate and chat with the parents and give them a chance to be more involved with their baby. An example of a nurse-led intervention that involves pumping or establishing breastfeeding is skin to skin. So it increases parents' confidence in holding their baby and just transferring their baby from the crib to themselves and giving them more confidence in being involved. And skin to skin helps with bonding and comfort for both the baby and the mom. Even dads too. It's very encouraged to have dads do skin to skin as well. And it prepares the baby for breastfeeding. So the baby might be too tired one time, but they might show some signs that they want to move to the breast and try. And if they try, then it's moving forward. This slide goes over the importance of parental education. First off, we want to present education to parents because it prevents readmissions. In this case, it can prevent failure to thrive later on, to ensure the baby is growing and eats enough, that they're getting enough milk. And then we want to make sure in our parental education that we're providing consistent information, because there have been many studies that have shown that trust erodes in the healthcare team if they're presenting different information and if they're not aligning. And then you want to ask open-ended questions. So it's better for the conversation of providing education. You can find gaps in knowledge rather than having them answer yes or no. And then you want to prevent present this information at multiple points throughout their stay. So at the beginning, we like to do our admission teaching, and that's like drinking water from a fire hose. They're still processing their infant is going to stay in the NICU and that they're being separated. So it would be helpful to do frequent follow-up. So do little bits of education in subsequent stays, in subsequent NICU visits where the parents are visiting, and then just throughout if you feel like they're not comprehending, then maybe just ask them more questions. And then it's important not to make any assumptions. So just because it's the mom's second baby or she's had other babies, we can't assume that they know everything about breastfeeding or breast pumps already. They might not have been able to breastfeed their child the first time. So, or they had problems with latching or just problems with a breast pump and they just gave up, or they were too stressed. So we need to be aware of those things and check for if they need help. And then we need to ensure education is in their own language. So where we work, there's a lot of Spanish population, Spanish speaking. So we need to make sure that we are getting the interpreter and just providing them resources in Spanish and making sure that they understand and ask them frequent follow-up questions as well. There's some barriers and facilitators to breast pump usage that we might want to keep in mind and consider when we're providing education or not getting very much milk initially. And some of these are patient factors. It might be physical factors. So a barrier is that the flange doesn't fit right, that the pump's not working. So we might want to check those pump settings and if they're getting the right suction and if the flange is fitting. Because if they get the right flange, then that makes all the difference. There might be emotional factors. So if the mom is just feeling so stressed out and guilty for not being there for her baby, that could be a emotional factor. Having proper support is a great facilitator for the mom. So just cheering her on and helping her with encouragement is helpful. And then there might be some social obstacles like lack of time to pump or privacy or support, or they feel judged, or they can't get the proper transportation to bring their milk to us. And so we need to work with the mom and figure those things out. It's important to provide a good place to have them pump, so that's helpful, like having a private place to pump. So these are the nurse and hospital factors with barriers and facilitators to breast pump. So staffing. When we are short-staffed, we may or may not feel like we have time to teach these moms properly. So it's important to have adequate staffing for this. We want to provide consistent education, and that's been shown to be a strong facilitator of breast pump usage, that everybody's on the same page and we're providing the consistent information so that moms don't get confused or frustrated. The availability of a lactation consultant is a facilitator, so if there's one available all the time, that's great. Currently, we will go over the lactation hours, but it is not 24/7. And then nurse attitude. So look inside yourself. What is your attitude towards breastfeeding? Breast pumping? Did you have an easy time? Did you have a hard time? Do you think it's not part of your job to help with breast pumping? And helping assess your attitude and seeing what you can do to change that attitude, or a nurse attitude is also a facilitator. So if you're wanting to be helpful, that's great too, and making time for it. And then clear guidelines. So we want to establish clear guidelines so that everybody's on the same page, and later in this presentation, there will be presented some guidelines. This slide goes over lactation consultant hours. They are daily, so Monday through Monday, from 9 to 3 o'clock. And the information for that is posted in the NICU break room. The next topic we will go over is pump education. This slide goes over basic pumping instructions. The instructions are to tell moms to expect to breast pump 8 times a day, every 3 hours for 15 to 30 minutes on both breasts. They want to start with a high speed and low suction until milk flows. And then we want to tell them to adjust to the medium setting and increase the suction as they feel comfortable. Step 5 is a video by Ameda, which is the company that our hospital uses for breast pumping, and the kit is the same, so it just goes over instructions in more detail and provides you with a visual of what to expect. These are some helpful tips we want to educate our moms with. We want to tell them if it's helpful, to keep a breast log. This can be written or mobile. We do have a written breast log available if they want breast pumping log, if they want it. It is helpful to have a mobile application because their phone is right there with them. So that might be more helpful to them. And then the first few sessions will only have a few drops of colostrum, but that's okay. We can have them put it on their colostrum, whatever they pump, onto an oral swab, and we can swab their baby's mouth with their colostrum. And then transition from colostrum to mature milk occurs by day 4. We want to go over the importance of flange size with them. So a small flange or a larger flange might not be effective in pulling all the milk, or it may cause chafing and hurt. And we don't want that for our moms. And it is also helpful to set an atmosphere for pumping. So some people like to put a picture of their baby in front of them, or get a baby blanket from the NICU that they've been in and smell that blanket, or they like to pump in their room, in the baby's room. And then we can tell them that not to stress about nighttime pumping for one of the sessions, because it's very important for them to get sleep, so they can have a 5 to 6 hour gap and skip one of the pumpings. This is what our breast pump kit entails. These are all the parts. So the breast flanges are at the top, and they attach to the mom, and they come in different sizes, so make sure they assess which size works for them. The 4-ounce bottles are what collects the milk. There's the valves, and we want to make sure the valves are intact, because that affects suction, and those attach inside the part inside between the breast flange and the milk bottles. The diaphragms go on top in that cylindrical breast flange place, and that helps with preventing milk going into the tube. And then the caps with locking rings, that's just the caps for the milk bottles when you're done. The tubing is what you attach to the electric breast pump to the flanges. And then the tubing adapter is to make sure you can attach the tubing to the breast pump. And it also makes it so you can block one of the areas to only pump one breast, but it is more efficient to pump with both breasts. And then they have the adapter caps that attach to the tubing to the breast flanges so that it attaches, the whole system attaches. So this slide goes over breast pump assembly steps. So number 1, if the kit's sterile, if it says on the bag that it's sterile, then a mom can use it. Otherwise, they will want to wash the parts. Put the diaphragm into the breast flange. And then number 3, put the adapter cap with the tubing to the top of the breast flange. Number 4 is push the valve onto the underside of the breast flange. Number 5 is screwing the collection bottle onto the breast flange. And then number 6 is push tubing adapter with the tubing into the port of the pump. So I provided a picture of this. So the tubing adapter goes into that port, and I have that labeled. And then there is a speed, suction, and time. So the speed is how fast you're pumping, which is on the left. And then the suction is in the middle. And then the timer is just kind of to tell you how long you've been pumping. I did provide a link to a video demonstration which goes over this if you would like a more visual representation of what this is like. A lot of the problems with this, with breast pumping running into problems, is caused by suction. If they're not getting suction, then they're not going to get the breast milk. So the first point is a video demonstration by Mai Ameda, and she goes over what to look for in the pump parts. So you want to make sure they're connected, you want to make sure they're not torn or broken, especially those flanges, because they can rip. And then you want to make sure that the correct flange is for the right size for the breast. So we want to provide cleaning instructions for these moms because we don't want them to get mastitis and pass any infections onto the baby. We want to make sure that they're using clean pump parts. So they want to wash their hands first, and then they'll want to wash pump parts that touch milk into a clean basin. So not directly into the sink because that's dirty, but we can provide them with one of those plastic basins. And pump parts that touch the milk are mostly the flanges and the bottles. The tubing does not touch the milk. That's what the diaphragms are for, to prevent milk from flowing into them. So it's recommended not to wash the tubing because milk doesn't touch it. And then you want to air dry those pump parts. And number 5 goes over not sanitizing the tubing, adapter cap, or tubing adapter because those don't touch the milk. The bag that is pictured is where you would put all of the flanges and bottles, and the instructions for it are on the back, and it really depends on how strong their microwave is on the time they need to put it in the microwave. But they do want to put about 60 mils of water in there, and then per the manufacturer's instructions on how long to put the time in the microwave. And you want to do that once a day, at least sanitizing them once a day. After use of pumping, you want to wash the parts in the sink every time they pump. Labeling milk in the hospital is very important here. We want to make sure that there is proper labeling because we don't want to give the wrong breast milk to the wrong baby. That is a serious safety event. And every baby has a breast milk fridge in their room, so make sure we tell parents that. And picking up milk, we want to make sure that everything is labeled. So we want to make sure that the mom labels her own milk so that we know that that's her milk and she's confirming that's her milk. With picking up milk, we can tell them that their maternity nurse can pick it up and bring it to us, or we can pick it up and bring it to us. Just let us know. But if they want to walk down to the NICU and visit their baby, that's perfectly fine. That's great. It's important to go over milk storage safety with these parents. These are recommendations from the CDC. So it is good after they pump, 4 hours at room temperature. So they don't immediately have to put it in the fridge. They can pump, and then an hour later, if their baby's hungry, they could feed it by bottle. They could feed the baby by bottle. It's good for 4 days in the fridge and 6 months in the freezer. And when they thaw the milk, make sure they know that it's 24 hours good when it's thawed, and to not refreeze breast milk that has been thawed. This page goes over breastfeeding resources, and you are able to click on the links and it will take them to the web pages. This page presents breastfeeding resources in Spanish. So these are the same links to previous, only they're in Spanish, in the Spanish language, so you can give these to mothers whose first language isn't English and that it may be Spanish. The last link is virtual breastfeeding consultations, and that page is in English. However, you could scroll down to about middle page and it will say Recursos Español, and that's where you could find some education that's in the Spanish language. So now that we have the baseline information, what are we going to do moving forward? So the following 3 slides are the posters for the new practice guidelines, and these will be displayed in the NICU break room. So in this situation, when a mom gets admitted for preterm admission and labor and delivery, we want to coordinate with the nurse practitioner so we can come with her when they're doing the NICU consult. When we're in there, we want to address their feeding plan. So if their feeding plan is to breastfeed and provide breast milk for their baby, we want to make sure that the mom has a breast pump or a way to pump her milk. And then we use a mobile app called Keratin, and we want to present them with a QR code so they can download it and get familiar with the application. They are spending a lot of time in labor and delivery, and sometimes they're spending weeks, so they can go over this information, and there is breastfeeding information in that app that may be helpful to them. And then when we do visit, after that, we want to make sure there's a care coordination note in the mom's Epic chart. And the poster shows a picture of where this would be. For practice guidelines for NICU and maternity report. So when a baby gets admitted to the NICU from maternity, we want to make sure we're addressing mom's feeding plan. We want to ask the nurse what their feeding plan is if they're doing formula or breastfeeding. We also want to ask the nurse if they have a breast pump set up in the mom's room, and we want to chart this all in Epic under nurse communication to show that it's been addressed. And if the mom hasn't been seen with lactation consultant, and even if she has, we might want to have the maternity nurse re-put them on the list. And then this poster goes over guidelines for the NICU admission. We want to make sure that the moms are being seen by lactation within 24 hours of admission. We want to make sure there's a lactation note within 24 hours of admission. And upon admission, print milk labels. We want to ensure a breast pump is in the NICU room. So when we hear that there's an admit, we might want to make sure there's a pump in their room, in the baby's room. And then chart breast pump education by day 3 of admission, and set up a social work consult as needed if the mom is having trouble getting a breast pump and needs assistance. And then the graphic on here is the education on milk pumping that we're looking for. The plan moving forward is to have a skills day, so that will be next month. And then we will, in the skills day, you'll pass off on putting together a breast pump and verbalizing some of the information in this slide. And with the skills day, there will be a simulation, so you'll be in a situation with a mom involving breast pumping. And then there will be a post survey after Skills Day, and then you'll have a week to answer that. And then 3 months later, there will be another post survey in which you'll answer. There will be chart audits from Skills Day on to assess if we're following these guidelines. And updates will be in the NICU newsletter. And then we will reassess in 3 months or 3 months after the skills session for new hire education and establish that. So I just want to make sure that you know to sign up or to sign this sheet that is attached with this to ensure that you have done this education and have seen this presentation. So this is a poster on the project timeline. You can read it and see where we're at in the process. We are currently on month 3 and we've emailed the presentation out. So the next steps are to conduct the skills day and start chart audits after that. And then the next is, and a post survey. And then in 3 months, post survey and reassessing education and establishing for new hire. So I just wanted to thank you all for watching and reviewing this presentation with me. These next 2 slides are my reference pages, so you can see all of the studies attached with this presentation.